ওরে বাবা ওটা ছেড়ে দাও
ওকে
ওটা ছেড়ে দাও তুমি এমনি করো ওরে বাবা ওটা ছেড়ে দাও মাম্মা কিভাবে করে মাছে কিভাবে করে মাছে মাম্মা এটাতে না দিনে এই টাইম হয়ে বসে আছে আমার চ্যালেঞ্জার সে কি অনেক আগে share the button.
Actually একটা ইনভাইটেশন ইউআরএল আছে আমি সেটা পাঠিয়ে দিচ্ছি তোমাকে you can send it to all the people তোমাকে একটা ইনভাইটেশন ইমেল ওটা আমার কথা শুনতে পাচ্ছ হ্যালো
হ্যালো শুনতে পাচ্ছ
হ্যাঁ
শুনতে পাচ্ছ
হ্যাঁ
হ্যাঁ দিয়েছো মনে হচ্ছে
তোমাকে হোস্ট করে দিচ্ছি মেক হোস্ট ঠিক আছে তোমার ছবি দেখা যাচ্ছে না কিন্তু
দেখা যাচ্ছে না
না শুধু আমারটাই দেখতে পাচ্ছি তোমার ছবিটা যা সন্ময় মুখোপাধ্যায় বলছে
এখনো বলছি মিটিং উইল স্টার্ট ইন আ ফিউ সেকেন্ডস
ও তাই নাকি আমি তো স্টার্ট করে দিয়েছি
রেকর্ডিংটা বন্ধ রাখো আমি কিছুই দেখতে পাচ্ছি না আমি আবার জয়েন করব
তুমি দেখতে পাচ্ছ না
না
দাঁড়াও
তুমি শুনতে পাচ্ছ আমাকে
হ্যাঁ শুনতে পাচ্ছি
আমি আমি দেখি এটা বার করি ওই এটা স্ক্রিনটা আসলো শেয়ারিং এর তারপরে চলে গেল আমি কি ঢুকে আবার বেরোবো
বেরো তুমি কোথা থেকে তুমি কম্পিউটার থেকে করছো তো
হ্যাঁ কম্পিউটার থেকে এই তোমাকে দেখতে পাচ্ছি আমি এখন তুমি কি আমায় কন্ট্রোল দিয়েছো তুমি let me get out and join back হ্যাঁ আমি দেখতে পাচ্ছি আমার নাম রেকর্ড করছি এখন so maybe you should get rid of the recording.
Let's start.
Good morning everyone. I believe people will join us as we go. Yes, some of us probably are having a little difficulty joining in. This is Sanmay. Hi everyone. We are this is a subject which is quite complex and difficult to probably understand in one little shot, but I'll try to make it as simple as possible. Okay, let me try to get to that. So let me start with the Yoga Institute I have been, and there's a CNN report on that. Some of you guys may have seen this, which talks about how yoga is actually scientifically being used for the treatment of diseases. So here we go. Chasing Life by Dr. Gupta, CNN.
Sanmay, we are not able to see the video.
Dr. Gupta is as flexible as I am, looks like.
Can you share that window? Sanmay, we cannot see the video.
Okay.
Can you share that screen? Can you share that screen?
Can you see now? Can you see now?
No, we are just seeing that slide.
Better?
No, the video window is not there. So you have to stop the presentation, Sanmay.
Okay.
And then you will stop the slideshow.
Okay. And give the screen. Can you see now?
Yes. The sound, is there a sound?
No, cannot. Can you?
Yes, we can see the video, but can't hear any sound.
Okay, let me see what the sound is. Can you sound?
No, you're on mute.
So hopefully you can hear the sound. So basically this is an experiment being done on certain yoga postures and the impact on the heart. And now Dr. Gupta is going to be subject to an EEG, how the breath impacts the sympathetic and parasympathetic systems.
Activates the rest of the G systems.
Yeah, so here what they're talking about is basically how yoga postures are used as a disease management tool, like a medication. So you increase or decrease the medication to impact your disease, management of your disease, and they're basically showing that how different yoga postures, breathing, and meditation, they all impact different parts of the body, different parts of the system, our different systems that we have. And that is the key of this whole presentation. So yoga and the management of yoga for diseases is being used like almost like a medication. So that's a dialogue they're having. Sorry, I don't know why it's not doing this, but hopefully, let me see if I put myself on, got out of the mute mode. So basically, can you hear us now?
Yes.
Okay. So sorry about that. There was a
Can you please put the video links later on the chat window?
Yeah, we'll do that. I don't think I'll play the video anymore, but we'll do some discussions on on those. So because it's kind of not working. So that's one aspect of it. This is where I trained myself to be a yoga scientist, which means that we actually use yoga postures, breathing, meditation, and there are a whole bunch of other techniques. There are thousands and hundreds of techniques that can be used to manage certain diseases. So for blood pressure, you do certain types of protocols. If you have a cardiac ischemia, you use certain protocols. If you have an autoimmune disease, you use certain protocols. If you have stress and anxiety and depression issues, you use certain protocols. Just like modern medicine uses medications and some health, life changes, yoga is all to that. Actually, yoga always looked into that. It's but yoga looks at it in a more holistic way, which is just not the physical aspect of it. Look at the breath, we look at the mind, and if there is a mind, we look at that. And I'll go into that more in detail later on. But one of the things we are seeing with modern medicine in US, as you all know, that we are one of the highest, probably the highest spender on of GDP for healthcare. Yet our outcomes are terribly low, and I'll go through that. Out of the 37 nations, we are like almost the lowest of the chart. Yet we spend 3.36 trillion, I'm having the figures here, 3.36 trillion dollars expenditure, which is about almost 20% of our leading companies. Out of the leading US companies are McKesson, CVS Health, and United Health Group. So the amount of money these companies make, yet our health is not the best. It should be the reverse. The other thing is, the spinal cord, the spiraling economy, the spiraling costs, which actually led to the Obama's ACO and other accountable healthcare, Obamacare basically, was to help the population which have major issues, so that in their primary care, so that they don't go into the hospitals, and the hospital costs are the most expensive costs in the country. There are also, of course, there are other attitudinal issues. There's a loss of human factor. That's where yoga and a lot of alternate techniques come in. It's a human approach. So a yoga therapist or a yoga disease management person or a PhD in yoga are trained to work with the physical level, breath level, mind level. So it's more of a holistic approach to the whole thing. And that's the critical thing. The modern medicine is very specific. It's great for trauma. If you are in an accident, heck, you don't come to a yogi, you go to a modern doctor. But if you have a chronic pain, which is not going away, and you are putting pills after pills, if you have stress management issues, and I'll show you the breadth of research that has happened to really get to the core of it, which again, the yogic theory is the mind is the seat of all diseases, and out of mind comes stress, and out of stress comes all kinds of diseases, and these are physiologically proven now, that how stress impacts the hypothalamus and how it impacts the sympathetic and parasympathetic nervous systems, and how all of that can play a role in the different systems. You have your cardiovascular system, your musculoskeletal system, and a whole bunch. So I'm not going to go too deep on the anatomical side of it, because that's not the purpose of this. The purpose is to show how yoga can manage in parallel to what you are doing with your modern medications. And maybe eventually, as you get into and manage and self-cure, come out of the deadly opioid crisis. Opioid crisis is a big crisis, and pain management. That's one of the key reasons why I have the list here. Like almost all the health facilities, the academic, especially the academic health facilities, have an alternate health section, and within that, yoga is a very big, playing a big part in that. And University of Maryland, USC, UCLA, UCSF. Actually, I was talking to a doctor from UCSF. She was giving a talk in one of the therapy conferences, and how people are going towards that. So I know some of you are in my class in the county, and you know how I use those therapeutic techniques a little bit and at a time. And all I wanted to make sure that you guys understand after this, that why I do that. And there's a whole bunch of information here. I'm not going to delve with every little slide, because that will be like a 10-hour session. But this is the crux. The crux is we have a crisis in modern healthcare. In cost-wise, we have a crisis pain management-wise, because opioid is a crisis. We do understand chronic diseases. That's the bottom line. And if you talk to a doctor deep enough and long enough, you'll figure that out, that they really don't get it. There are a lot of tools and techniques they have, and therefore, and they use it, but they're also, if you have one-on-one talk, they Well, I didn't know. We are experimenting actually. And the same, that's where the whole alternative, whether it's yoga, acupuncture, Pilates, all of these things have come up. Ayurveda, there are, acupuncture has a whole bunch of clinical studies, about more than 25,000 professional studies. Ayurveda has about 7,000 professional studies. Ayurveda is the oldest medical system in the world, which deals with the health in a very different way. It actually customizes your healthcare like on a one-on-one basis. So every person, every time of the day, every season, every weather, they take considerations, all of you and all of the surrounding. That's kind of customization they do. They do not say, okay, you have a gastric problem, you take antacids. No, a gastric problem could be, very severe for one, not so severe for another. Gastric problem will depend on how your body and genetic structure is. And then looking into all of those different factors, an Ayurvedic doctor will give a prescription. So yoga and Ayurveda works together very well. Yoga also the same thing. We will not do certain things for suffering from certain diseases, and we will do certain things for certain diseases. So basically customization, putting the human factor on, putting the hat on where you look into your body, your mind, you have this one-on-one relationship with your person you are working with, and adjust your dosages. If you can do one asana, say we do bridge asana, but be done in 200 different ways, depending on your situation. And so the yoga therapist and you have to work together to get into that. So that's the whole emphasis. Modern medicine is becoming non-human. We are trying to make it more human using the alternate methods. Modern medicine is not as customized as these alternate medicines are. Modern medicine is very standardized. Alternate world is not as standardized, but that's the plus and minus. But alternate world is also becoming a lot more standardized. And the alternate world depends on the individual doctor, which is also true in the modern scene. The individual doctor is also very, very important. There are so many different types of doctors. They are all coming from the similar tools, but they're very, very different. So the human factor of the individual doctor and the patient, and that connection is very important for disease management. And the other thing is yoga and Ayurveda teaches you how to self-manage in a more natural fashion. Whereas in the modern medicine, you're really dependent on the doctor, and we are not against any system, but what I'm saying is these alternate things are the alternate. There is this modern medicine, which we have to use. It has a lot of benefits to us. And then on top of that, we do these things specifically on the chronic disease management side. So there are some discussions on the cost and the Mayo Clinic, CBS, and others. I have the links to you guys later on to take a look. It will take some time, and we are having some audio issues with the videos. So we'll skip that. This is a chart. You can take a look. And heart disease, cancer, respiratory issues, cardiovascular, Alzheimer's, diabetes. These are the statistics from the Center of Disease Control, and it's almost like epidemic proportion. And I have the actual anatomical discussions on all of these diseases, but I'll go through very fast and go to the actual yogic part of it. So in heart disease is typically the cardiovascular system is going wrong, is the blood pressure, so let me go to this. So before I go, just like final, United States is ranked number 1 in obesity of the 35, 37 leading countries, ranks 33 in diabetes. number one in drug-related deaths. That's the opioid crisis we have. It's actually out of control right now. And number one in pharmaceutical spending. A lot of it has to do with the way system works. And that's where, the alternate world has some hope. And because of this, there's an increased interest, as you have talked about it, in integrative health and yoga therapy, other approaches to, is a big thing. And parallel to that, the yoga therapy research and other researches in the alternate world are giving a lot of evidences that now we have data. I can quote my paper in prestigious journals saying, okay, this protocol of this was done and diabetes really reduced on a cohort of 100 people. So that kind of scientific research is going on throughout the world. In India, in other countries in the world, in some of the institutes, I know Texas, University of Texas does a lot of research. USC has done some research. UCSF is doing a lot of research in collecting data and saying, hey, this is the one thing we are following, but there are other things we can. Okay. I hope it was not too fast. I'm trying to pace it out as much. Hopefully everyone is doing okay. I see a few familiar names here. Actually, all the names are familiar. Christine, Josie, Michelle. Hi, Michelle. Rajiv, who's my son-in-law. He's keeping a tab on me, how I am doing. So I have Arup, my partner in crime on this whole thing. And I'm supposed to have a few more people joining in, but hopefully they'll join as much, not having trouble joining in. Okay, so this is the heart, complex system, and I'm making it simple. The deoxygenated blood is coming into the right atrium through the superior vena cava, through basically to the veins, going into the artery, through the pulmonary artery, oxygenated. The oxygenated blood comes into the left atrium and goes to the ventricle and into the aorta throughout the body. And eventually, cells get oxygen via that mechanism through fine tubes of capillaries. People who know just high school level biology know that. So basically, this is an exchange system whereby we collect all the toxins in the terms of CO2 or carbon dioxide and replace it with an oxygen. That's why we breathe, and that's why breathing is so important in yoga. The better you can breathe, the more oxygenation you can get, and it will help you in overall health in general. So that's about. I'll go. I can go very deep into this, but the purpose of this class. Again, the blood pressure is a big issue. We need to control our blood pressure. We have basically 3 categories of drugs to do it. But there are a whole bunch of studies that have shown exercise, yoga, breathing, meditation, and different types. And again, when we as a therapist, trained therapists, we do it. We just don't give any yoga therapy, okay, you do this asana and you will get better. No. Specific asanas for specific diseases. For example, if you have a cardiac issue and if your blood pressure is little on the higher side, we normally tell people not to put your head down. Headstand is a no. It's or even hand to feet posture, standing Paschimottanasana posture, Padahastasana. That's not allowed. We do more breathing here because we try to oxygen. And again, we'll come to the parasympathetic, sympathetic system. We try to do a little more meditation, a little more breathing, calming breathing to invoke your parasympathetic or the vagal nerve. Vagal nervous system is very, very important, the parasympathetic. For your health, for the immune system, to fight inflammation, and so on. So a crux of modern medicine and a crux of yogic medicine is this. In modern medicine, we are seeing a couple of key things. Modern medicine has also started talking about stress as a cause of a lot of these diseases. though the emphasis is not as high as yoga. Yoga is saying stress is the cause of almost 95% of psychosomatic diseases. That's number one. That's a difference. Modern medicine uses medications and interventions quite a lot. Yoga will use medications. Yoga's partner is Ayurveda, but as little as possible, only when needed, kind of a situation. And that's the antidote to the opioid crisis we have. Pain management. Yoga gives a lot of postures for pain management. I know I have pains in my body, and I handle that. My wife does. There are a whole bunch of people, even in the class in a county, we do that, and so on. So it's a holistic approach, a whole thing. And so let me go through this. So blood pressure, you know blood pressure has a whole bunch of impact. The blood goes throughout the body, and therefore any perturbation in the cardiovascular system will impact throughout the body. That's the whole thing. And again, what we are seeing as I was talking, the stress is getting there in the attention span of the doctors. Inflammation is
Yeah, there seems to be a technical difficulty. We are trying to fix that.
okay. I think I'm back.
Yes, you are. Just open the presentation again, please. Hold on a second. We are trying to fix the technical issue.
Hey.
On my?
Yeah.
Yeah, now we can hear you.
Okay, sorry guys. First time.
No worries.
Pardon me, monsieur and ladies. Okay, so I think I'm going to make it a little faster. That way, this will be a little. Let me see my controls. Okay. So we talked about the vertebrae. We talked about there are different disc issues there. Spinal cord, melanoma, not melanoma, myeloma is. Let me go back. Hold on. So myelopathy. Sorry, myelopathy is the impact of the whole system on the spinal cord that causes a lot of pain. So yoga has very, very beautiful postures and breathing and techniques and mind calming techniques, because again, we believe that it's all coming foundationally from the mind. Arthritis, common problem. Osteoarthritis is age-related. Rheumatoid arthritis is an autoimmune disorder. Inflammation happens on both cases. Autoimmune is more inflammatory, and therefore what we do. So again, the osteoarthritis and rheumatoid arthritis are treated very differently because of the sources are very different. Autoimmune is where your antibodies are killing your own good cells. So basically your body is turned against yourself. Allergies, a whole bunch. Asthma, triggered allergy. Asthma. When asthma happens, what happens is the airways, the normal airways, the ventricle gets diminished, and therefore you can't breathe. And there are specific yoga techniques for that. For example, if you do Kapalbhati, which is fast exhalation, which I do in my class, and most of my classes, that helps in clearing your asthma. Health, the other biggest issue we have is the digestive system. A whole bunch of diseases, some of them are autoimmune, like IBS is autoimmune. And it basically boils down to stomach, the creation of the acid and the secretion of all the juices, the enzymes that help digestion. And if your acid level and the pH level is not right, and your digestive juices are not getting produced properly, they have problems. And this is directly connected again to the mind, because the sympathetic and parasympathetic nerves, they all supply, the nerve endings go to this whole gastrointestinal system. And any perturbation up there causes perturbation over here. Diabetes, insulin goes up, insulin is less, so the glucose level goes up in the blood. And therefore, and the blood, that high blood sugar is going toward the body, causing a whole bunch of havoc into your system, stroke, seizures, all kinds of things can happen because of diabetes. And yoga also has a very, very good protocol for diabetic management, which came out in the British Journal of Medicine years back. And is being, in the yogic circle, it's quite used effectively. Immune endocrine system, again, allergy, asthma, skin issues, drug allergy issues, and all that stuff. Then autoimmune system is the thyroid system, the diabetes mellitus, which is type 1 is a autoimmune order. Rheumatoid arthritis is an autoimmune disorder. Immune deficiencies again causes infection, cancer. If immune system is weak, a lot of diseases can get in. So quickly, cancer is good cells, bad cells, replication, destruction. The bad cells are winning out. Oncogenes are in the activation of cancer. Macrophages are antibodies, which which are trying to fight it. And when in case of a cancerous patient, basically the imbalance has occurred, and we need to have, there are, so as far as cancer, and I have been treating a few cancer folks around me, is a whole bunch of it is pain management, stress management, and then trying to build that immune system up. So hopefully, along with modern medicine, and all the facilities, the chemo and others that are being given, we do the protocol surrounding those, so that in the intermittent period, during chemo, there are some protocols. And then after chemo, there are some protocols. And then if the patient gets better, there are certain protocols. So use that so that fundamentally a vagal stimulation happens, so your system is calmed down to fight the diseases much better. 2, you invoke a lot of breath, so you're oxygenated to the hilt, and then your overall immune system goes better and better as we go to fight the disease. So that's kind of the concept. And then eventually there are deep meditation techniques in cancer patients which help in the stress reduction, stress of the disease, not just stress of the disease, coping with the they go through a lot of depression, and in fact some cases where they're brain cancers and they go through delusionary, their realities change, and then you have to handle that. You have to counsel that properly. And the yoga and different systems have the different approaches to calm them. But generally, yoga therapists would calm yourself at a very deep mental level, as opposed to a doctor who probably is going to give chemotherapy and give some kind words of compassion. But yoga techniques are there to calm your mind at a very deeper level and help. For example, if you have brain cancer and if you do sound, which we do in the class, there are people who said it works wonders for them. It's first of all, it's a huge important thing for pain management and feeling good. It's just important thing. You have to feel good, otherwise you cannot fight a disease. So things like that, small things, which are very, very important in terms of. So this is the crux of the matter. We have the spinal cord, we have the sympathetic systems and parasympathetic. Sympathetic systems do certain things, parasympathetic certain things. Parasympathetic is more on the calming of the systems. Parasympathetic is fight or flight. If you get excited, your pupil dilates, you start, your heart accelerates, you start breathing heavily. One of the key things here is, if you just look at this slide, is, for example, if a person, parasympathetic stimulation or the vagal stimulation is generally very good. But for example, a person who has acute asthma, we would not give the protocols for parasympathetic calming down, because that will constrict the bronchi more, and therefore it will be a problem. Okay, it will not heal the person as quick as we want, or especially if the person is in a mode of attack. We do not give calming at that time. We give a lot of forceful breathing, breathe out kind of thing. So that kind of helps. But it's not just breathing again, it's breath, it's mind, the meditative side, it's also a lot of asanas, movements that can help. So this is, again, in yogic terms, this is Ida and Pingala, and the middle thing is called Sushumna. It's been there for thousands of years, the thought of the Ida, Pingala, Sushumna, and how controlling of the three can control your whole system. Same thing, same discussion, sympathetic and parasympathetic stimulations. I'm not going to go into deep into that. There was a YouTube on this, which I'll send it out later on. It's a very, very important, it's a very touching YouTube on depression. Depression is a crisis in this country. And whether sometimes we don't even understand that, but there's some simple depression, and could go into major depression. And generally, the psychological issues are on two categories. One is the neurosis and the psychosis. And yoga has important protocols for these. For example, anxiety is fluttering of the mind. Your mind is high speed of the mind. Whereas depression, the mind goes really depressed, the lack of a better word. So you go slow. You do not want to do anything. So they are anxiety and depression are taken at the same breath, but they are actually two things in two different poles according to yogic sciences. And we give two different protocols to people who are high anxiety. We give them a lot of exercises, a lot of fast exercises, followed by deep meditation. In the case of depression, we somehow have to give them a whole bunch of activities so that they at least come up at a better mental state. And then we will give them more calming techniques to have control over their mind. So there are a lot of subtle things that we do. We learn how to do all of this. Obesity is a huge problem. So let me get into the crux of the thing on yoga. Yoga, the whole therapy of yoga or yoga system, basically, I'm making it very simplistic because there are a whole bunch of other books and scriptures on this. Yoga Vasishtha, Bhagavad Gita, and Yoga Sutra. These are the three seminal texts that really deal with the mind, and therefore studying these help a lot, especially who are doing therapy. I've studied all three, especially the last two, the Bhagavad Gita and Yoga Sutra. Yoga Vasishtha I've referred to. It's a 60,000 verse scripture, which is hard to read, and Bhagavad Gita and Yoga Sutras are much smaller. So I'm again crystallizing. Yoga Vasishtha says the yoga is the skill to calm down the mind. Manaha prasamanaha upaya yogaha. So how do you calm down the mind? The mind is always part. There are thousands of thoughts in our mind, and therefore, even when we are focused, we have background noise going on, and yoga does help in doing that. And so the other thing is, corollary to that is the dexterity of action. So if you have a controlled mind, if your thoughts are on your control, if you can switch on and switch off at your will, then the action you take will be more dexterous. So you'll be more effective, more efficient. And that's what Bhagavad Gita is, a more implementation-oriented scripture, which helps that. And then we come down to this Yogaha Chitta Vritti Nirodha, Yoga Sutra. This is a highly used text, scripture used in the yogic circles, technique to calm down the perturbation of the mind. Basically, it's saying the same thing, but it goes even more deeper. And we are giving a very simplistic explanation of this. Chitta Vritti. Chitta is just not mind, it's beyond mind. So mind has different components, different aspects of the mind. Simplistically speaking, you have the conscious, subconscious, and deep subconscious. But the whole Eastern science of mind breaks down mind in a much more minute, granular fashion, and has techniques to control, parts of that. So that's the foundation of it. Another foundation is another text called Upanishads, Taittiriya Upanishad, which talks about body and mind as it's not just the body. Okay, yeah, it's body, but then what else? You have breath, right? So pranayama. You have manomaya kosha, which is the mind level, and then there is a layer called intellect, layer of intellect. So your mind is kind of your emotional side of it, And then your mind also has the intellect side of it, the discussion, the discrimination, the argumentative side, where you actually analytical side, where you look into it and decide between good and bad. And then there is an existence which yoga believes in, and I think a lot of people believe that there is beyond all of this, which is a pure blissful state. And if you can do all these things right, properly, you probably would be in a very blissful state. And being in a blissful state is the desired state for all yogis and all people, actually, so that we can have control over diseases. That's the foundation. Disease is very looked at in a narrow focus in the modern medicine, whereas in the Eastern medicines, disease is a lifestyle thing. It's more like if you are not leading the right lifestyle, things happen. So disease is like a corollary to your lifestyle. And even World Health Organization has been talking about that. I'll go to the slide on that later on. So again, Annamaya Kosha. So this is basically a physical layer. So at the physical level, we need to have control over diet. We need to have proper exercises, asanas, and kriyas are cleansing techniques. So there are a whole bunch of, I don't know how many of you guys know Neti Pot, but if you do Neti Pot, it cleans up your sinuses. So that's one simple. There are a whole bunch of cleansing techniques. The fast exhalation is a cleansing of your lung, which is good for your asthma. So that is another cleansing. And I can go into a whole bunch. There's a lot of very esoteric techniques which are not done these days, but they are there. It used to be in the olden times, a lot of people used to do them because we probably didn't have enough modern medication and healthcare system, and those cleansing things were important at that time. Then we have the whole level of breath, prana. Prana is, you do a lot of breathing, and that impacts your mind, your body, your all the systems. And then we go to the mind level, where basically you do two things. One is you can do meditation of different kinds, dharana, dhyana, different kinds of meditation. And then categories of, not different kinds, but categories of meditation. And then you have the emotion culture, which is actually, and then I'll go to the next slide on this, emotional culture and this perception correction and happiness analysis. They kind of, you try to control your emotions. You have anger, you have anxiety, you have hatred. You try to get rid of those through meditation and through analysis. Vijnana Maya Kosha is the analytical, the intellect side. But you actually think through, why am I angry? Why did I get so hateful? And try to correct that. And there are meditative techniques which will, there's one technique called Vikyasa, where you actually basically you look at a very hateful or a painful situation and turn it around into a very happy situation. This is very, very important to understand these techniques, to get out of those mental blocks. And then Anandamaya Kosha, which is the blissful state, is a state where you are working a selfless service. You are happy. It's like your cells. Your cells are all doing their job without any expectation, right? The same thing. If you can go into a state of being where you work for the love of the work, and other things, are secondary to that, and that's the important piece. That's why they say you should never work or go into a profession which you do not like. And that's the number one thing. And then there are so many other factors of this selfless service. There are layers of it. For example, if I do a service and I'm looking for fame, so that is really not selfless service. If I'm looking for money, that is not really a selfless service. I mean, those are services and they're good, but there are different layers in the scriptures that talk about how to become truly selfless, where you don't expect anything, you just do for the love of the job. A little bit theoretical in today's age, but it's a good yardstick to have so that we can all try to be as happy as possible doing our daily chores. Again, we going to the same thing. I'm going to skip all these slides. So basically, in yogic terms, so there are diseases which are genetically coming, and those are difficult to get rid of through yogic protocols. But there are a whole bunch of psychosomatic which you get through your stress level and through your non-handling of diet and stress and way of life. Those can be handled very effectively through yoga and through alternate world, through Ayurveda, yeah, of course. These are the psychosomatic and somatosomatic diseases. And there are other types of diseases which occur without which you don't have any control. Injuries, infection. You got exposed to toxins. You really there are remedies for it in the sense that you can handle them. Of course, you use medicines as modern medicine plays a big part. Surgery and all the big part. But you also use other aspects, chanting and proper breath and other things to help the whole process. So, but the focus of yoga therapy is this middle portion called samanya, or common diseases, which are coming from the mind, or mostly in the stress-related diseases. This is another slide which talks about mental diseases, which actually happen in the intellect level. We talked about the beyond the Manamaya Kosha, there is a Vijnanamaya Kosha, the intellect layer. That's where a lot of the mental derailment starts happening, and it works it through. So what happens is the mind gets disturbed. The stress, it happens in the mind. Mind gets disturbed. That disturbances flow through your prana or breath, and those disturbances eventually flow through your body. And depending on your genetic constitution, your diseases start happening. So if you have genetically prone to cancer, cancer can happen. If you're genetically prone to autoimmune diseases, that will happen. So that's the whole theory. It's everything starts from the mind and percolates down, and all in the value chain from mind and beyond mind, actually, the intellect level and the Anandamaya Kosha, the blissful level, they get disturbed. And the whole technique, the whole process is to calm down the mind. That's what the texts are saying. And that's what we plan to do. And there are definitive protocols these days being designed to attain that as effective as possible. Quickly, prana or breath, basically we call it breath, but prana in yogic terms means much larger than that. Prana is the life force. So I don't want to go too detailed in it. And we in the system, we have thousands of nadis or energy channels through which prana flows. And it's also in the Chinese system and other Eastern systems. They call it chai, they call the meridian system. And we have our yogic nadi system. And those systems are basically, the blocks happen and the blocks are released through breath and through asanas and through meditation. And in the Chinese system, we have acupuncture. They put the needles in there to clear the blocks. If you have ever done acupuncture, you'd hear the acupuncturist talk about those things. So again, stress is speed. Mind is fluttering. Your high speed. I could see in my classes when I say to slow down, some people cannot slow down. They are doing it at a fast speed. And I can say that, I can kind of guess that the mind is also, and it happens to everyone. It happens to even practice, seasonal yogis. So mind, speed of mind. And this is the crux again. I'm probably repeating myself. The speed, controlling that speed is the most important thing. Same discussion. This is just a little slide that I created with the demanding situations, how all these external and internal things conflict and create the high speed. This kind of show the speed of nerve impulses, you could say that, and then the way the firing happens within our internal, nervous system that starts creating all these diseases, and the immune system gets definitely impacted. And again, look up vagal systems. You'll see the vagal nerve is so important, the parasympathetic. And controlling your inflammation is so, so important to do that. You've got to have the nervous systems right. They are controlling, from its brain and the whole nervous system. So it's our memory, our whole system is just not controlled by the brain. It's controlled, yeah, it has a large control in the brain, but it has a whole bunch of other things that are correlated to it. So they say that the intelligence is spread throughout the body, just not the mind, just not the brain. This is a very open field, which scientists and ideologists, so people who believe in, spirituality, they are, discussing, conflicting. A fascinating field where, psychology is such a fascinating field from that point of view, and a whole bunch of issues. Again, I'm probably repeating myself, but again, mind should be like a clear lake, but it's actually like a, violent movement of life forces within ourselves, creating a lot of disturbances. Haphazard breathing, when you get stressed, your breathing starts haphazard, and we need to calm down. All the what we see today is just the tip of the iceberg. And as we go deep into it, we will start seeing how the mind plays a much, much bigger role than what we really think. These are some of the techniques: breathing techniques, relaxation techniques, pranayama, which is a deeper breathing, positive guided imagery, pranic energization. These are actually, they have specific meanings, which I'm not going to go into it, but so each of these have a specific purpose. As far as breath is concerned, as far as relaxation is concerned, as far as the mind and imagery is concerned, as far as your prana or the energy levels are concerned. And sound is very, very important. Just like a soothing music or a nice music calms you down, we use a lot of sound to impact the mind, impact the stress levels. And I do it in the classes a lot of times, so now you know why I do it. This is a very high level discussion, the mental level, dharana, dhyana, samadhi. There are three techniques, 3 layers. Dharana is concentration, dhyana is concentration without any effort. So you are naturally concentrated. Whenever you look at something, you're just into it. And samadhi is a very deep state of mental calmness in a situation where you are almost out of your current realization into a very, very blissful state. When you are in samadhi, you are in this higher blissful state. And therefore, any diseases will not even bother you. I mean, it's one thing is you have what diseases are not. You may have diseases, it can happen, because you went through probably in your life through genetic cycles. There are so many different ways of disease coming into you. But generally, psychosomatic diseases are less. And generally, I mean, the psychosomatic diseases may have happened before you actually went through this path. But if you are in a state like, in a higher level of state, mental state, you can handle diseases much better. That's one of the things. Your diseases don't bother you as much as if you are not in that state. Again, this is just a comparison. Our eastern side, we have prana, chai, all these the mediators. They're actually the invisible forces, the life forces, the breath. The whole thing is being used to control a lot of diseases. And in the modern medicine, it's a more electrochemical mediator, and that works on the ANS, cytokines, etc. Summarizing, diet at level, asana. Anna is the physical level. Control your diet, you control exercises, asanas, you do your cleansing techniques. Those are the interventions. In the level of breath, you have pranayama, breathing practice, relaxation. So when you do like an alternate nostril breathing, left nostril, right to right, right to left. So do that and you calm down. So that's one of the techniques. Then you do meditation for the mind level. Whole bunch of techniques. You also look at why your mind is so disturbed. You do analysis of that. And then the intellect level is where you listen to lectures, you do counseling, you talk to people, you understand the system. That's the whole purpose of what I'm doing here. The people who do yoga can understand why we are doing this. And then this higher level of Anandamaya, or the blissful layer there. So these are, so the crux of it again is modern science deals with mostly the physical layer, and of course it started with the physical layer, and then it's now going beyond that. But yoga actually started from the outside. It's the definition of human being is they're all blissful people, and then goes down. So it's kind of a reverse approach to the whole thing. And we always looked at a life as some layers of existence, not just the physical layer, but layers of existence. And therefore, treatment of one has to be done with treatment of others, and it has impact on others. And so therefore, it is a much more holistic approach to mind, body, and soul, if that exists. Again, so this is an important thing to know. It is a WHO slide, actually. It's a state of health, but well-being. We need to be in this green-blue range, where where state of health is good and we are perfectly state of well-being. So basically, mind, body, and the illness is on this other side. But that is the whole approach, and health is being defined that way. If you go to World Health Organization's definitions, you will see how they are getting, that they have taken a more holistic approach. Anxiety, I will go very quickly through this because I think it'll be boring otherwise. Anxiety, these are cohort studies. So we took like 50, 60 people in there, did some yogic protocols to see the yoga control, the yoga yogic group shows much better after a few weeks. Depression, the same thing. The depression started, in this case, started doing much better very quickly. It's called Beck's depression score. So basically, you ask the patient questions as to how do you feel, what do you do this, how are you feeling this way, how are you feeling that way. There are like 50 or 60 different questions, and you score them, you rate them, you rank them, and you come to these conclusions. There are definitively important impacts of anxiety and depression with yoga. Effect of breath. So people think, how can breath handle different diseases? For example, let me give you an example here. Acid peptic disease, which is basically peptic ulcer and IBS. What happens according to yogic theory? So prana, again, we talked about life forces. They are of several types. Here we're discussing three, which are important ones. The prana, which works in the head region, the samana, which works in the mid portion, and apana, which works in the lower portion. So apana it takes care of excretion and urinary, all the excretion stuff, reproductive stuff. Samana is more on the digestive side. And the prana, the head region, is on the energies in the head, your thinking, thought pattern, belt, in all kinds of upper region movements are handled through these life forces. So this is in contradiction kind of with the modern medicine. Here we are talking about life forces which makes things happen. Why does your blood flow throughout your body? Yoga is saying there are life forces which makes it happen. Why are you thinking? Why are you thinking? Well, what is a thought? Why are you thinking? It says these life forces are actually acting to create that thought. This is an invisible life forces. They are operating on all living creatures to make them do what they do. Why do you excrete? I mean, you couldn't have excreted. Why you do that? Saying these apana vayus or pranas will help excrete, and therefore controlling when these pranas or life forces get out of control at different regions, you use different types of yogic techniques to control them. For example, in this case, you do sectional breathing, which is, I think most of you have done, the belly breathing, the chest breathing, and the shoulder breathing. You do it in sequence, that will kind of will start working on your mid portion. Okay, the disturbances in your digest. Basically, it's the small intestine and large intestine, that stomach, that region. It starts working on that. And also, in a lot of my techniques, I use sound, different things at the different parts of the body. For example, the lower part we use ah, mid portion we use ooh, and the head region we use These sounds also work along with breath to mitigate the disturbances of the prana. Okay, this, if you see what 12 rounds 4 times a day, this is Nari Suddhi, which is alternate nostril breathing. I think I do it in most of my classes. And if you do that 4 times before food, that helps. That will help a lot of the digestive issues you have here. So that's in a very simplistic way. I mean, if there's a yoga person here, I would have to really explain deeper, but I'm not going there. Again, same thing with different, just to get the idea is there are different types of life forces within the body. There are actually 5 life forces. These 3 are the main. And there is a Vayana, which actually does the whole body thing. So the blood circulates through the Vayana Vayu, or the Vayana life force. So these are to be controlled primarily through breath, some through meditation, and also a whole bunch through your daily practices of physical postures. Same thing, same going on. Asthma also the same thing. Asthma again, it's a parasympathetic stimulation. This is one of the oddball things where parasympathetic actually constricts the broncho alveoli over there. And therefore, this is a bronchoconstriction happens during asthma. And we do forceful exhalations, which is Kapalbhati, one of the techniques again to do bronchodilation. So here we do sympathetic stimulation instead of parasympathetic stimulation. Again, a lot of studies of what drug score went down. Drug score meaning how many drugs you were taking before and after. Do a protocol of yogi protocol. PFR is the flow rate of that has increased, shows increase. Eosinophils, lymphocyte counts, all these showing great improvements. Yoga for arthritis. Again, arthritis 2 types, osteo and rheumatoid arthritis. Rheumatoid is autoimmune disease. And the other one is osteo, which is age-related. Autoimmune is your own cell killing your own cells. There's a big play with the beta. There's the lymphocytes or white blood cells. Highly complex structure, coming of the thalamus, has to do with the pituitary gland, how it works with the different macrophages within your bloodstreams. And the beta cells and T cells have very, very complex, even modern science has not figured out how they all work with each other. I've studied a lot on these things, and my thesis is also on autoimmune diseases, which it's the disease that I carry, and therefore I have had direct impact on how yoga could help in those. That's a different story altogether. So again, diabetes helps a lot. You know these stories, look upon insulin imbalance, and again, yoga helps. Obesity, people think that yoga doesn't help in obesity, but it does. Over a long period of time, done well, and done the right protocol. If you, I used to be 30 pounds heavier, and the last 3-4 years I've slowly taking it off. And it has to do not only with your diet and exercise, but it has your mind. Because obesity is also a deep-rooted mental issue there. So if the mind doesn't work, if your mind is always perked up, you are highly stressed. There's so many things can happen. You can eat more, all kinds of, you do not exercise. So that apart, the mind's, the psychosomatic issue is when the mind is perked up, the way it acts on your nervous system, the way it acts on your hormonal system, that itself causes increase of weight. So keep that in mind. Again, we're treating it as a holistic approach. These are all different, weight improved, BMI improved, O2 consumption improved, fat percentage went down. All these things are studies that has been done at different places. Another thing is IVF and general pregnancy. People use it a whole bunch of techniques to have the mom and the baby in a calmer state of mind, so that pregnancy is smoother, the issues are much less, percentages of fertilization increases. Is some of the techniques called mind sound resonance techniques. It's a seminal study that has been done several times, and it's supposed to be hugely impactful to, again, strength, dexterity. It's one of the things. There has been a study on the strength, grip strength, just by doing breathing. How you improve your physical strength and grip strength. I'll show you that. This is not the one. There's another one here. This one. Your strength generally improves. For example, here they got 5 groups doing different things of different yogic things. Okay, some did alternate nostril breathing, some just observed their breath, some did some mudras, which are, we do some of that in my classes. You do hold your fingers in certain positions. You do right nostril, Surya Anulam Vilam is right nostril breathing, left Chandra Anulam is left nostril breathing. And as amazing results, they found that the grip strength of those groups increased with the alternate nostril breathing, but not with observation of breath. So it's a kind of interesting observation. The dexterity improves. There's O'Connor's tweezer dexterity, which you use a tweezer to put some stuff in a hole. That showed increase. Steadiness increases. Again, balance along with that increases. That's why we do the tree posture all the time, and other balancing postures. We do the pole walking. Again, it's almost all aspects of physical, breath and mental aspects are handled. We knew it from thousands of years back, but nowadays the scientists are actually testing it out. Physical well-being, how your lung is functioning, how GSR is the galvanic skin resistance, which is connected with your mood, and they check the skin resistance to see how you're doing mood-wise. So there are a lot of tools available these days, even apps available which do that. People don't know. Trataka is a very important technique to improve the eye, and there are scientific studies on that. Focus, defocus, no focus. There's certain ways of, there are subtle things you have to do to get the result. That's the point. People think, I've seen a lot of people, I've given them some protocols. They did for a few days, they say, well, it doesn't work. Well, yeah, it will not work. Unless it is done right, under proper supervision, it will not work, at least initially. Now, when you know how to use it, and that's the whole purpose, again, we give transfer knowledge so that the patient becomes the doctor. That's important to understand that at some point, the way healthcare is going, we have to have enough knowledge. Google helps, but you have to have all kinds of knowledges to handle your health. That's a key important factor. And that's why I see in the next 10, 20, 15 years, all these alternate techniques taking a major role, because the healthcare costs are not sustainable. And you have to do self-care. We're doing it for so many different things. We'll do it for health. Again, visual reaction, yoga for memory. The other day I did in my yoga class, Tapu Pranam, you just hold your ears and do up and down, sitting up and down. And this is the simplest way of putting it. Improves your spatial memory. There are, spatial memory is the right brain thing, verbal memory is the left brain thing. And you handle different breathing techniques also to handle the right side versus the left side. You saw that old, the video, probably the sound wasn't there, of Dr. Gupta. He was basically doing that. He was doing this alternate nostril breathing, and his right or left brain was showing different types of oxygenation. That is what it is. It is actually very, very scientific, and which was in traditional knowledge. Now it is becoming scientific knowledge. Emotional stability, of course, hugely emphasizes it. Again, Kapalbhati with the fast exhalation improves your sympathetic activity, which you need sometimes. And Nadi Shuddhi, or alternate nostril breathing, it really increases the parasympathetic and calms you down. So we have seen that in our classes also. When I do, people, it's really calmed down. followed with meditation and other things. Sweat is a technique which, so we sleep, right? We sleep to recover, we rest. But in yoga, rest and sleep are two different things. In yogis, and I have seen that in my life, I know of some people who sleep very less, but yet they're absolutely full engaged. And I have a monk I know who is 95 years old, in Globetrotter, and he sleeps 2.5 hours. I know that because I stayed with him 7 days in a place, and we went together. And I know he sleeps only 2.5 hours, but he never, 95 years old, he never gets tired. So yoga, and this is a controversial thing, if doctors will say 8 hours or 10 hours sleep is absolutely needed, which is probably true for most people. But a real practitioner of yogi with all these different techniques, it shows that transcendental meditation or cyclic meditation, savasana properly done, they can really give you the rest you need. You don't have to always, like sleep. Okay, I mean, sleep is definitely important. Of course, you need sleep. But again, this is something which is to be taken very, it cannot be taken lightly. It has to be. But there are studies showing that the restfulness and consumption of oxygen, even the psychological aspects of thinking or feeling restful or feeling restful, all these studies have been done in different psychological magazines and yoga magazines. And some of these names you see here are pretty well-known people in the yogic world, and I mean, it's coming from them. So I take my 8 hours sleep. Without that, I cannot live. But there are again the same thing with a lot of restfulness. You can get the requisite rest that you need. The emotional factors, these causes stress, infatuation, arrogance, jealousy, anger, greed, intense desire. They're good at certain points in life, but you pay a price for that. At the same time, there are sort of a lot of these things you don't need really. After all, life is about happiness, and do you really need all of this? You can make much better livelihood, but you can do without. I mean, even being a calm person. I mean, I see more situated persons are more successful actually in a lot of places. Not always, but you see that all the time. So, and these things create a lot of psychosomatic disturbances inside, and the less you can do, the more control you have. And there are techniques for that. Again, there are real rigorous techniques to get out of negative emotions. And love, compassion, content, they're actually related with good hormones, which actually make you healthier, make you happier. So go for it. I mean, we need to look at it, look at life in a different way. This is a study I found, and so it may not be that important. There are a lot of studies between both nostril breathing and uninostril breathing. And for example, the SAB, which is the right nostril breathing, improves oxygen consumption, digital pulse, average BP, GSR, just sympathetic stimulation or sun breathing happening. And there are other techniques, some of them, the CAV or the left nostril breathing has importance in the, again, as I said, the parasympathetic stimulation. And coming to the end of it, there's a whole bunch of other things. There's all kinds of tests and higher brain functions, logical brain functions, strategic planning. So I've been talking to my boss about it in my office, saying, hey, I mean, let's do certain techniques so that you can be situated enough to think strategically. And these people are looking into this in the boardrooms these days. There are certain people who are, certain companies who are integrating some of these techniques in there. Hopefully one day the county will do, and other places will do. Again, all different things. So social health. If you are healthy, if you are mentally stable, your surrounding gets stabilized. Your social. In fact, there are some studies on transcendental meditation long time back, where they did those in certain cities, in enough number of meditators meditating, and they found that the crime rates going down. Again, these are some studies. The validity of it, I don't know 100%, but I've read those studies. Apparently, there are a couple of few studies like that. Again, last but not the least, here I'll just show you my app. I mean, most of you have that. With all these in mind, we created this app. And my friend, my Arup, who is also in this call, is actually controlling this session. He developed it with my input on the yogic side. He's the technical head of my little institute that I have. And if you see, there are a lot of different wellness techniques here. 15-minute, 1 hour meditation, mobile wellness. I have a whole bunch of people, not whole bunch, few people right now. My marketplace, where I'm going to add some doctors in there. There are, so just show you, this is me, that's my wife. This is another gentleman in India who is also a very well-known therapist. This is an Ayurvedic doctor. And this is a speech pathologist. All these people. Pardon?
We are not able to see the app if you're sharing the app.
Okay, let me see how I share this. I'm not being able to.
The presentation mode for the PowerPoint. Then...
Yeah, let me go there. Hold on. New share. Yeah. Can you see now?
Yes.
Okay. So again, a lot of you have seen this, different groups we have, but let's not go into the detail here. So maybe give you an overall view of this. Okay, this is a network of this is me, my wife, this is a gentleman, he's a crazy guy. He handles oncology and heart diseases in the clinic I go to in India. This gentleman is a PhD and an Ayurvedic doctor and a yoga therapist. This is also a speech pathologist who is also a yoga practitioner. Actually, this is my daughter. So, so we have a few little group, and we are expanding this group as we develop into a more robust machinery. Again, this app is actually linked with Alexa. You can talk to Alexa about Dr. Yogi. I hope it doesn't get triggered right now, but we can do certain things through that. So that's the idea of having this app connected to your TV monitor or connected to Alexa or any sound or any other sense triggered stuff that will really trigger this app, and you can do it without always looking into it. Maybe hear it, or maybe you put it on a large screen and see it. And eventually probably you'll do it on your own and not need it. So, and we'll continue to develop this. Challenges is, of course, like any small organization, entrepreneurial organization, is money, but we are getting there slowly. We are not in a rush. We do not desire. Our desire is to help people, not to really make money out of this. And this is a conscious decision. It's nothing wrong in making money, but we're trying to do as much as we can to help. And that's one of the reasons I'm going to counties, homelessness shelters. I've started going there. I've been there once. I'm hooking up with them. And so if I can give them, and most of the homeless people, believe it or not, have smart apps, smart phones. And if they can start using that, that will be a big thing. Even if they use it partially, they will probably get them to a better position. And I'm going to do the same thing with all the people. One of the goals and this I don't want to really show the whole thing, but just to show Uh, this is kind of the video scribe I have. Anyway, so you can see it separately. Look at the intro. It's all of these things we have done it, with as minimal cost as possible. So some of the qualities are not that great, but we'll get there. There's a start. At least people can start using it and get helped, and we will get there one of these days. So so coming back, let me. Again, I have used all these kinds of research to develop this. Some of the slides I've taken from different people. Some of these slides some of the slides are mine. Some of these slides I took from my school I went to. Some of these we took from the different books. I have, and I have a whole bunch of other studies which I want to basically develop this into maybe like 2 or 3 major disease group discussions where I can go deeper and have discussions with not only who are using the yoga protocols, but also with healthcare professionals, and try to make them understand that there is a whole bunch of the whole world out there which needs to be tapped into. And that's going to be my journey and my partner's journey, and he's helping me in so many different ways. He's the architect behind this whole app. It's not easy to do an app like this with all the videos, and our app works even with the worst kind of Wi-Fi or internet connection. It's an amazing algorithm he has used to cache things in certain intelligent ways so that the thing is usable even in the remotest of the corners. I mean, I've used it in India where Wi-Fi is very, very low in certain parts of India. But in my yoga institute, at certain parts there you have nothing. Even there, we could you could use this app to a certain extent. So I've experimented that. I've experimented that in trains, it's moving in high speed. So so the basic technology is there. We have to make it much better, much expand it. I'm going to start focusing on certain disease groups. 1 is cancer, 2 is cardiology, 3 is overall pain management, and 4 is pregnancy and IVF, which has become a big issue. So building these prototypes and protocols surrounding that and giving it to people so that they can benefit out of it. That's me. So if you have any questions, let me see what questions are there. Oops. Okay, can you share? Okay, so we are at the end of our thing. Let me see what questions are there, if at all. Sorry for all the technical glitches, and it's a long subject to talk about. Maybe next time we'll cater it, make it simpler. But I tried to make it as simple as possible. Hopefully you got a glimpse of what it is, the yoga techniques for disease management. And appreciate all of you coming here.
I have a question.
Yeah, go ahead.
So if any of us want to get in touch with you for a private consultation, what do we have to do?
I think there's a link to info@mandukya.org. I think that's a way of reaching me, or you can call my number. Most of the people here have my number. 714. Yeah, we can do that. And the info, basically send an email to the info@mandukya.org and we'll go there. So people who want to know why we gave this weird name Mandukya to the website or our organization, it's because Mandukya is a scriptural text which only 12 verses are there, but it talks about mind, body, soul, and four states of matter. So when we are awake, when we are sleeping, when we are in deep sleep, and then when we are beyond that. So that's the whole yogic concept of you have different parts of the system and you have different states, and the intersection is where you want to know where you are and how to come out of it or how to enhance that. So that's why it's a very important text which talks about the whole psychosomatics of not only diseases but the whole wellness thing, and that's why we chose that name. And Dr. Yogi is a catchy name which I gave it to my app, because Dr. Yogi helps everybody to cure or help in a yogic fashion. So
Thank you, Sanmay.
any more questions?
And if anyone has question, you can just type it up on the chat.
I may have gone a little faster. This is the problem I have. I try to give too much information at too little time. Well, give me feedback as to what went right, what went wrong. We'll improve on that. Give us feedback on whether I should make it even lighter. Maybe not give as much information. And I have cut down a lot of information. My initial slide was like crazy, but I can do that. Just let me know so that we can really help people out by giving the right level of. It's an introductory thing, so I think it's more. I have gone beyond more than introductory, but it's important to and at least know from how you guys felt rather than me thinking. So
Sanmay, one thing that I'd like to make a comment here is that it's a fantastic presentation. I thoroughly enjoyed. Not just because I'm your partner, but a lot of things are something I had no idea and I learned. But maybe next time what we can do is take one or two disease group and explore that.
Yeah, that's the intent. I know there are so many disease groups are there, so but I'm trying to focus because one of the issues that always happens is that you try to get defocused. So many things, so much material, so much to talk about. So I'm going to start discussing cancer. I'm going to start talking about pain management in general. I'm going to start talking about pregnancy and IVF, and I'm going to start a bit on the autoimmune diseases. So those are the 4 diseases, and we have protocols for all variety of diseases, but those are the 4 I think I'm going to start focusing on, and those are kind of the key issues that I'm seeing all around me. I think that will be the best use of all of our time. So if you guys have questions, shoot it right now, or else we will maybe talk one-on-one. I know all of you. So shoot me at least a separate email on how you liked it, what you didn't like, was I boring, was I going too deep. This is actually, most of the times I've done technical webinars where we have jazzy slides and things, and you can go deep into it. But here it's a totally different subject, and I'm still not 100% sure where and what depth I should go. So there could be, there could be some learning from there. So let me know. I appreciate all your feedback, and we'll improve this. Yoga is all about improvement and learning. without attachment. So without ego, without thinking that, well, it has to be this way. There are, billion people, billion paths, 7.6 billion, I guess, or 7.3 billion. And each individual has a different path. There's no single path. And therefore, each disease, even within a disease, each individual has to be handled differently. That's the customization, and we have to go through. Okay, if you don't have any questions, we'll call it quits here. Thank you for patiently hearing this old guy for this long. I really appreciate it, and we will connect. Thank you, Arup, for all the help. Without you, I couldn't have done this.
No problem, it's my privilege.
Thank you, and shall I quit now?
Yes.
Okay, wonderful. Thank you, everyone. Bye. Have a nice rest of the day.
Bye-bye.
Thanks. Bye-bye.